So I'm doing my incentive spirometer checkoff. We have a patient that is getting her gallbladder removed. Pre-op, we will go down and just kind of educate the patient on how to use the incentive spirometer, just so that post-op she's more familiar with how it is and why we're doing it exactly. So surgery went well. It is now time to go in and do the therapy. So we're going to check the patient's chart for a chest x-ray, previous vitals, and possibly check the pain medication therapy so that if they need a pain pill, they're getting it before we perform the therapy so that it's less painful and we'll get better results. We can knock. Hello, I'm Abby from Respiratory Therapy. I'm here to work with the incentive spirometer. It should only take 5 or 10 minutes, and it's just a treatment or therapy to help prevent atelectasis and pneumonia that could happen since we're not up and active as we used to, and just to help while you heal. Can I get a name and date of birth? Thank you. So before doing therapy, we would do pre-assessment, check vitals, breath and lung sounds, kind of get an idea there. Then we want the patient sitting in an upright position, so we can raise the back of the bed up. We can have them sit on the edge of the bed if they're not in that much pain. They could be in a wheelchair sitting upright, that would work. Since the patient did just have gallbladder removal, we would possibly want to use a pillow for splinting to prevent any pain that could happen. So once we have them all ready, we can take our incentive spirometer, and inside the bag there was a chart. So our patient's 5'2" and only 60 years old, so we're able to see that her predicted value volume is 1900. So on the bottom here, we can put the patient name, the room number, the date, and then the predicted value or the goal overall value we're trying to get. Once we're performing the therapy, we really just want to hit 1/3 of that and kind of start there and go up. So we're monitoring volumes here. So we will have the patient kind of educate them that they're going to hold it upright, kind of at a level position. And we can, here on the side, move this to set the predicted goal. So once we have that all ready, we'll have the patient exhale and take a deep breath in, so that once they're taking the deep breath in, this will go up. And while we're watching them, we can monitor like what volumes they're hitting. And then we kind of want to instruct them to hold their breath if they can for 3 to 5 seconds. And then just exhale normally. We want to do that 6 to 10 times every hour if possible. While they're performing a therapy, we just want to watch their technique, how they are actually performing the therapy, if they're doing it correctly, if we need to switch something, if they're not able to get it. We also want to monitor the volumes that they're getting. If they're reaching their volumes, then we want to reassess their goals. We always want to make sure to educate them on not to do it too fast. That'll just to prevent hyperventilating. We just need nice and controlled breaths. So once they have finished the therapy, we have educated them on everything looks fine, we can do a post-assessment, just reassess the lung and breath sounds, their vitals. We always just want to make sure this is in the patient's reach. So we can set it on the bedside table so it's in reach. If they were able to get this, mastered it, they seem to be okay with that. They're able to do that on their own 6 to 10 times every hour. Or let's say they were a little confused this time and maybe just wants maybe another, for us to come back in the next hour and just help them do it again. We can do that. So then once we're all finished, we can follow up or finish charting and then follow up if needed.